Hi, I would like to talk about teleconsultation and what is it all about. What is teleconsulting? It's a quick and convenient way to digitally contact your healthcare professional to get advice from them. It is also referred as a remote consultation or telehealth, so that patients can get in touch with their healthcare professionals without having to take time out to visit the hospitals. Here are some of the challenges faced by patients during the COVID-19 pandemic. First is, do you know some patients skip follow-ups because they are afraid to go to hospital during this COVID-19 pandemic? Secondly, flights going in and out of country are cancelled due to this pandemic. Thus, patients can't come or travel to seek for medications. Not only that, people that are staying in the rural area will find it difficult because of limited resources in their area. Patients do not seek for medical advice if they think their illness is not critical or severe enough because they are afraid to leave the house during this pandemic. We have gotten a feedback from a successful doctor. The first question that we ask him is,
so teleconsulting is useful where history can be taken from the patients. It becomes quite an important tool to use if you are away from the patient, allow patients to communicate with the doctors and vice versa. Currently, we use this platform to get in touch with our patients who are out of the country. Some of these patients are patients who have had treatment. They are on follow-up. We know what are the possible side effects to expect. There are some patients who already are on treatment and we like to know how they are. But these treatments are perhaps oral targeted treatment that they can take the medication on a daily basis. That allows us to observe and see how they are. And these are patients who are suitable. Oh yes, we have a patient who is actually on treatment. That's an oral targeted drug. It's a very specific case because the patient has had some treatment here and she's actually progressively getting better. So we know she's on the right track. And then after that, we had a lockdown in the country. So we're able to keep in touch with her and see how she progressed. Now, the good thing with this teleconsulting we have is that the moment she became worse in terms of her symptoms, we're able to tell us what was troubling her. The actual remedy was advised accordingly. She managed to get to the hospital, get the appropriate treatment done. Second line of treatment given to her. The last time we had a conversation with her, she's so much better. Her symptoms have improved. I'm glad to say that we have been fortunate to have this teleconsulting with her. Limited that I have. It's a very useful tool. You can be in touch with these patients and the patient can also be reassured. Teleconsulting is useful if we are able to talk, gauge our patient, assess them. There are many challenges still, I think. The practice of medicine still requires the clinical skills, not just by observing, but it's the examining the patients that is part and parcel of the whole science of medicine.
We don't feel like we are far away from the doctor.
Suami saya ini katakan bahwasanya, oh kita bisa jumpa dokter ini melalui video call. Ini ada fasilitas dari Pantai Hospital. Wow, saya ini senang sekali.
We don't see the difference. I mean, that's it. It's really good. So we just do all the blood tests and other things in Jakarta. Call the medication from KL, from PHK. So wherever doctor asks us to buy, and then we just buy, and then we import it through, from KL to Jakarta. Yes, it's really helped us. So it didn't break our continuous of try to get better and better.
Saya juga langsung bisa konsultasi langsung ke dokter tentang keadaan saya. Misalnya, oh tiba-tiba leher saya ini kencang ya. Ini dokter gimana ini? Apakah ini bahaya atau memang efek sampingnya seperti itu? Jadi sangat membantu ya Pak ya, ada teleconsulting ini.
The benefit of course in terms of cost. We don't have to fly. That the direct impact to us, I don't have to fly. I don't have to be like worry.
Saya juga bisa langsung dengar dari dokter ya, langsung nggak lewat siapa, tapi langsung. Jadi manfaatnya banyak sekali ya. Pas sudah janji, tiba-tiba di cancel karena ada pasien yang urgent. Nah, itu biasa.
We have to import the medicine from KL to Jakarta, so there is a additional import duty, right?
Saya sangat senang sekali ya, karena Pantai Hospital ini bisa melayani kebutuhan daripada pasien-pasien yang memiliki kendala untuk datang ke KL Pantai Hospital untuk check up kembali.
To us is really more than enough, and it's really good to us, and save cost.
Ia sangat-sangat membantu kerana yang paling utamanya adalah dari segi untuk buat pembayaran. Sebagai contoh, Encore ini tak ada. Kita terpaksa membuat semuanya secara manual, tapi melalui Teleconsultation yang Encore sediakan, dan melalui sistem tu pihak hospital juga boleh mempunyai akses untuk menyemak pembayaran dan seterusnya menjimatkan masa pihak hospital untuk membuat kerja-kerja.
Very straightforward, very easy, especially in this time, this challenging time lah, the pandemic, whereby we have the travel ban, patient they cannot fly in here, and then at the same time they really need to consult with our doctors, right? So this is the best option.
Dan untuk mendapatkan pandangan sama ada apa yang mereka harus lakukan, mungkin mereka tidak boleh datang di sini, tapi doktor kami dapat memberikan cadangan kepada mereka yang di mana mereka boleh mendapatkan rawatan sementara di negara asal mereka sekarang. Sebagai wakil daripada pihak hospital, saya merasakan yang ini sangat mesra pelanggan, di mana sistem ini sangat direct approach. Maksudnya dia sangat mudah untuk difahami dan mudah untuk menggunakan sistem inilah.
The doctor just have to open up the back end, click enter video call or video room, that's it. The patient just meet up. Everything is actually very seamless, First of all, patient have to go into the website and just click on the doctors that they want to see, and then after that they make an appointment, they make the payment, which is also very seamless. And then the next thing, when the patient gets the SMS, you have to click on the link that is located inside SMS, and then that's it.
Encore ini sangat-sangat membantu untuk kedua-dua pihak, iaitu pihak sakit kami dan juga doktor, di mana ia dapat menghubungkan mereka walaupun secara fizikalnya mereka tidak boleh datang ke Malaysia,